Psychopathology 770.
I'm Maria, not Marissa.
And I'm Marissa, not Maria. And welcome to the M&M podcast. Theme music.
It's gone.
And we're going to be eating some chicken while we discuss some things.
Some things, specifically OCD. That's what we're discussing
today. We're going to dive right in.
So, all of this information, you can find this in the DSM-5. It's by the American Psychiatric Association. The DSM-5-TR is the newest edition in 2022. OCD is specifically on pages 265 and 271. OCD is characterized by obsessions, compulsions, or both. The obsessions are persistent, intrusive thoughts, urges, or images that cause anxiety. For example, like a constant fear of contamination. And then compulsions are described as repetitive behaviors or mental acts performed in response to the obsessions, like excessive hand washing for the fear of contamination. There's also another one that talks about like harm or checking behaviors. That's like checking the lock repeatedly to make sure you've locked it. A lot of people think that these are just habits, and they're not. They're actually incredibly time-consuming behaviors or rituals that the person feels driven to perform to reduce anxiety, even though the behavior that they engage in may not actually directly correlate to the obsession.
The impact and time consumption piece, I kind of talked a little bit about before, but it's extremely time consuming. These individuals, they're committing more than an hour a day to just this routine or this activity. And this is causing significant distress in just various aspects of their life.
We also discuss there's specifiers that the DSM outlines for OCD. And there's three main insight specifiers that describe how aware a person is that their OCD beliefs aren't true. And that ranges from good insight to absent insight, or completely delusional beliefs. An additional source, Bajani et al. 2021, discusses there's 4 dimensions of OCD. So the first one is contamination or cleaning. So like excessive hand washing, which can result from this obsession of always feeling contaminated or needing to feel clean. And usually that hand washing is done so excessively, there's skin damage that's associated with it.
The symmetry and ordering, we're going to also call it categorizing. So it's just needing objects to be perfectly aligned, symmetrical. If you're thinking of like putting pens on a desk, they all need to be like perfectly straight. They all need to be the same like distance apart. And then also like repeating actions a specific number of times. So for example, having to like open and close a drawer a couple of times, and then on the third try, like you can open it fully.
Yep. Harm and checking. So it's constantly checking if the doors and or windows have been locked. Just with this preoccupation of like, oh my gosh, did I do it? Did I lock it? Am I safe in my own home? And then the last one, this one I feel like is a little ambiguous. But it's the forbidden or taboo thoughts. So intrusive thoughts about harming oneself or others. And then obviously taking preventative measures to make sure that you're not harming yourself or other people. And then unwanted sexual or blasphemous was the word that a lot of literature is used. We've changed it to like unholy or unpleasant thoughts. Another piece the literature was also pointing to, Ek-Iki et al. 2023 conducted an experiment where they were looking at what emotional schemas played a role with OCD, and they found that guilt actually played a significant role in all 4 dimensions of OCD. So like looking at emotional schema therapy and using cognitive reconstruction within the therapeutic setting to help kind of alleviate these emotional feelings that are tied to OCD is proving to be really beneficial in helping those with OCD.
Good to know. Alrighty, so we're now going to be moving on to prevalence, so how often OCD is being seen among different groups. According to the American Psychiatric Association, OCD affects about 1.2 people yearly in the US and worldwide. Looking at the bigger picture, Maggini and his colleagues found that the lifetime prevalence of OCD is about 1 to 3%. So this means about 3 in 100 people will experience OCD at some point in their lives. Wow.
That's That's a lot.
Well, and then the same researcher decided to look at boys and girls and men and women and like when the diagnosis kind of occurs in these individuals. In terms of males, they tend to experience symptoms earlier in life. And then they are more likely to have obsessive, unholy thoughts. And then in men, cemetery-related OCD is more common. Also, they have higher rates of substance use disorders, comorbid with OCD. And for women, OCD is starting to show up more so when they are experiencing puberty or pregnancy, so not as much when they're in their youth. And women tend to struggle more with the fears about contamination and aggressive obsessions. And then they tend to have higher rates of depression and anxiety comorbid with OCD.
It sounds like there's a lot at play here.
There's a lot.
It sounds like there's hormonal components
Absolutely.
that are a part of this too.
Absolutely. I mean, especially knowing for females, it's happening during times in life where there's like a big change in the body happening.
Yeah.
So like at puberty and then pregnancy.
Yeah.
I was like, okay. But I'm trying to think about what is it that in youth with these young boys that could be starting up this type of behavior. But I know that also some of our research has talked a lot about genetic components.
As with most mental health conditions, there's an understanding it's nature versus nurture, right? Really with OCD, it's both. There's so many things that can influence the development of OCD. Anything from complications during birth to childhood trauma, major life events coupled with genetic components that just create this, for lack of a better term, perfect storm for OCD to develop.
Yes.
And there's also illnesses that can create changes in brain chemistry. So in children, conditions like pediatric autoimmune neuropsychiatric syndrome. Say that 5 times fast, right? So for our purposes, we'll just call it PANS because that's what it's actually clinically abbreviated to. But basically what this does is it's an autoimmune condition that creates swelling in the brain that puts pressure specifically on the basal ganglia. Basal ganglia has a lot to do with the way we process information that's coming in from our environment.
Interesting.
So I guess to simplify it, it makes sense that this would have a role then in OCD.
Oh my gosh, absolutely.
Because if you're taking in information and the system essentially that's designed to process that information is damaged,
oh my gosh,
it's going to be interpreted in a different way. Additionally, identical twins with family members, so biological parents or a biological sibling that was diagnosed with OCD, 2 times as likely
what?
to be diagnosed
Whoa.
with OCD. Yeah.
That's so interesting.
Compared to the fraternal twins.
Wow.
Yeah. Childhood onset of OCD is largely genetically related. And the locations on that gene sequence that you can pinpoint for OCD, there's also correlations with those same sequences that can make an individual also predisposed for conditions like schizophrenia, anorexia nervosa, and Tourette's syndrome. We do have to talk about assessments, which is why, in part, we're in this class. So, we're going to explore this a little bit. So, obviously, we know DSM-5-TR has this really awesome level 1 and level 2 cross-cutting measure. But there's other measures that are used then to corroborate what we're seeing with the level 1 and level 2 cross-cutting measures. The most important one that you need to remember, because it is the most common one that is used, is the Yale-Brown Obsessive Compulsive Scale, which is abbreviated to Y-BOCS. Yeah. It's a 10-question quiz where each question is essentially 4 points apiece. So you can have a minimum score of 0 and a maximum score of 40. And the higher the score is,
the more severe OCD you have.
Yes.
Yeah.
Veloso et al. 2021 did a lot of work with that particular scale. The second one is a much more, beefed up version of the YBOCS. It's called the Dimensional Yale-Brown Obsessive Compulsive Scale. So it looks at 6 different aspects of OCD. Again, the higher the score, the more severe the OCD symptoms are going to be. For a shorter check, for something that's just kind of quick, easy, There's the Florida Obsessive Compulsive Inventory, shortened to FOCI. But there is a children's version of the Florida Obsessive Compulsive Inventory. It's a 2-part test. You are looking first at which symptoms you have, and then which and ranking how much then they're interfering with your everyday life. And there again, the higher the score,
the more severe
it's going to be. So this is the really fun part, I think, of this discussion, because we get to talk about the cultural
piece. There's a lot
OCD.
to that.
Yeah.
Kind of make my screen bigger. So Abramowitz et al. And Burnham et al. And Morris et al. They all highlighted how culture shapes the themes and content of obsessive thoughts in people with OCD. So the intrusive thoughts that feel personally relevant and most distressing often reflect cultural values relating to that culture group.
We can break some of that down.
Yeah, absolutely. We kind of found there being 4 main factors for how OCD presentation is being within these cultural groups. The first one is religious rituals. The second one is views about sexuality. The third one is political uncertainty. And the fourth one is responses to health crises like the AIDS epidemic and COVID-19 pandemic. There was a lot of different cultures that are impacted by OCD. I mean, I don't know what I was thinking it was going to be just like a couple groups.
The research surrounding Hispanic and Latin American individuals is so limited. But there was research done in Rio de Janeiro, Brazil, that discussed aggressive obsessions were the most common reported amongst the sample size. And that was at 69.7% of that sample size. That's huge!
Yes.
That's over half. And the second most common one was contamination obsessions.
That's still over half.
At 53.5%.
But like
Yeah. And I know something that was discussed within that study talked about how the crime rates and poverty rates have increased in Rio over the course of time, which has influenced then this need to act on aggressive behaviors to protect oneself. And then, the poverty piece of things, having contaminated water, having contaminated food sources, and just this fear surrounding getting sick from eating something because of the way that the economy is, which is impacting culture, which is now impacting our ability to accurately diagnose mental health conditions. And then we look at a comparison of U.S. Caucasian students, university students, mind you. So they're like our age, a little bit younger, and Mexican university students.
And Mexican students report greater overall OCD symptom severity than U.S.
Overall. So like looking at all the 4 dimensions that we had mentioned earlier, overall. Let's talk about Western Christian samples. This piece I thought was really interesting.
Yeah.
Equating sinful thoughts with sinful acts. So for those of you who don't know what TAF stands for, which is that thought action fusion, it refers to the belief that thinking about an action is morally equivalent to or increases the likelihood of performing that.
So in African Americans, they tend to experience more contamination symptoms at twice the rate of European Americans. And then with having a lower socioeconomic status, it's tended to be linked toward a greater contamination type of concern with OCD. And then this group tends to face more unique treatment barriers, including discrimination, fears, and lacks of resources, just because there's a lack of awareness surrounding it.
Yeah.
Which is just really, it's really sad.
And then we have Jewish communities. Jewish communities experience this very intense religious thought action fusion with OCD that relates specifically to Jewish traditions, rituals, and laws. Because of that thought action fusion, there's very common compulsions like washing,
prayer, consulting religious leaders, And Orthodox Jews, they are more likely to be experiencing this kind of religious obsession, OCD.
Eastern Islamic cultures, very strong religious themes in OCD.
Similar with the prayers and the washing, also with just in general the faith and the practices that are done, and a lot of the same things seen in the Western Christian sample of like the sinful thoughts lead to sinful actions.
And there's a lot of correlation too between the Middle Eastern Islamic culture and the conservative Muslims that were looked at specifically in Saudi Arabia, which was mentioned initially in this section. One study demonstrated that 50% of the sample size group of those conservative Muslims in Saudi Arabia reported obsessions concerning prayers and washing.
And then 41% reported contamination obsessions.
And then 34% reported faith-related obsessions. And something that's of note, first, the gender differences. Males report more of those blasphemous or unholy thoughts and ordering compulsions or categorizing compulsions, as where females show greater overall symptom presentation. With this same subculture, they're more likely to seek help from informal networks before seeking out mental health professionals.
Right. So like going to their religious leaders.
Yes.
Is like a big thing.
Yeah. The bottom line, I think, with this cultural consideration piece is there needs to be an understanding for those of us who are white clinicians going into this field. Our experience with mental health and the services surrounding that area are very different.
Absolutely.
From, and I don't want to say minority groups, but historically marginalized groups compared to what they have experienced when trying to seek treatment for what they are trying to manage in everyday life. And I think just knowing that there's an opportunity for a conversation to be had surrounding that. So that's
it.
That's OCD in a nutshell, presented to you by the M&M podcast.